Ladies and gentlemen, it is my great pleasure to introduce our esteemed speaker for today's Rotary Club meeting, Dr. Deborah C. Beidel. Beidel. Dr. Beidel is the trustee chair and Pegasus professor of psychology and medical education at the University of Central Florida, where she also serves as the director of UCF Restores. This groundbreaking clinical research center is dedicated to redefining our understanding and treatment of PTSD. A recognized leader in traumatic stress research, Dr. Beidel has pioneered the use of virtual reality in therapeutic settings, resulting in treatment methods that are 2 to 3 times more effective than traditional approaches. With over 300 scientific publications to her name, including journal articles, book chapters, and books, her contributions to the field are both extensive and impactful. Throughout her distinguished career, Dr. Beidel has secured over $31 million in federal research funding, focusing on the development and implementation of effective treatments for anxiety and PTSD within clinical practice. Additionally, she is a trusted consultant for state and federal agencies, as well as community organizations, advising on strategies to address the aftermath of mass violence. Please join me in welcoming Dr. Deborah C. Beidel.
Well, thank you for that kind introduction and for the invitation to be here today. It's really my honor to join you and to talk a little bit about UCF Restores. We are a clinical research center. They said, just press the button, but it's not working. That is dedicated to changing how we think about and treat anxiety disorders, and particularly PTSD. Just some quick acknowledgements, because I have to say that a lot of our work has been funded by the Department of Defense and also by the Department of Justice. They give me money, but they have no input into the research design or the outcome or the discussion of these particular studies, and I don't have any conflicts to share. We got to work it in. Thank you. All right. So PTSD has been around since the days of Hippocrates, actually, and it's been known by many different names. We've called it war neurosis. We've called it shell shock. We've called it unhappy heart in the Civil War. So it's been called lots of different things, and we know it's been there. But one of the problems is that the lifetime prevalence of post-traumatic stress disorder is about 30% of veterans and active duty military personnel. And the problem is that for a long time, we really weren't having a very adequate solution to combat-related post-traumatic stress disorder. And if you look at some of the figures, what we found was that $2.2 billion, or about 60% of the VA's budget, was going to people with PTSD who also may have had traumatic brain injury. The problem is that was only 29% of the people who were being treated at the VA. So there were lots and lots of resources that were being spent on a fairly small, significant percentage of the population. And so the healthcare costs for people with PTSD are 4 to 6 times the general population. So we've really got a problem. And what happened was, even veterans who would make it to the VA, and as all of you know, there's been lots of talk about how long it takes to get a position, to get an appointment at the VA. I had a colleague who came down to the Orlando VA, and she said the first day she got there, her appointment calendar was booked out 3 months straight with new patients. So even on that first day, if she wanted to see someone again, they were going to have to wait 3 months to get a second appointment. Well, people get discouraged. You know, if we think about a medical model, you go to the doctor and he gives you some pills and he says, take these pills for 10 days. And if it's not better, give me a call. Can't give you that kind of treatment when you have post-traumatic stress disorder, but we can't do it for 3 or 4 months apart. So what we found is that dropout rates are really high, even for our treatments that worked best. And that we really didn't know what was going on. People kept saying, we need better, we need different treatments. And so what we thought was maybe we didn't need different treatments, but we needed to do treatment differently. Okay. I swear, there we go. So in 2003, I had published a paper. We had been doing some work with Vietnam veterans. And then I moved down. I was up in Pennsylvania in the University of Maryland at that time. And I moved down here to Orlando. And the VA was this little tiny building over in Baldwin Park. And I thought, okay, I'm done working with veterans because there's not going to be any resources there. And I got a call from the Army one day saying, we saw your paper and your work with Vietnam veterans. Do you think it'll work better if we have veterans from Iraq and Afghanistan? And I thought, it'll work a lot better, because what I heard from the Vietnam veterans was, but doc, I've been on disability for 40 years. If I tell you I'm better, if I get better, nobody's going to hire me. I don't have a resume. So very valid point. But we thought we could work with veterans from Iraq and Afghanistan and be able to do some help. One of the reasons I came down here to Orlando was I was very intrigued by the idea of simulation and training and virtual reality. And UCF was a leader, even back at that point in 2007 in that area. And so I thought, this is where we can really make an impact. This is where we can change things. So if we think about the most effective treatment for post-traumatic stress disorder, it's called exposure therapy. And it's basically putting someone in contact with what we call the triggers or the cues that were there when they developed their PTSD. So if we're all sitting in this room now and suddenly a bomb goes off, and your attention is directed at me or this table, the color blue could become a trigger for any of you of the traumatic event. So you would have learned that when you are looking at blue, a bomb explodes, right? Now, not every time you look at blue that happens, but this is a very powerful event. And people talk about, after the Pulse nightclub shooting, I can't listen to the sound of that iPhone ringing, that marimba ring, because that's all I heard that night when I was inside the Pulse nightclub shooting, all those phones ringing and no one was answering those phones. Okay. Veterans will talk about the same kinds of sounds, that fireworks sound a lot like an AR-15 or an AK-47. Some people tell me that smells are particularly important, that specific smells will trigger memories. And so what we decided to do was we decided to incorporate virtual reality, because if you're afraid of a dog, I can bring a dog in and I can do exposure therapy. But if what you're afraid of is a piece of trash along the side of the road, because one time that trash along the side of the road was actually an IED explosion and you were injured or your friends were injured in that, I can't recreate that. I said this one time and I didn't know President Hitt was in the room. And I said, I can't set off IED explosions, on Memory Mall. And from the back of the room, I could hear, that's right, Deborah. So, we're not going to do that. So we had to come up with another way. So we started to look at virtual reality. The other thing that was happening was these high dropout rates and people not getting into treatment fast enough. So what we decided to do was we decided to flip treatment on its head and do an intensive outpatient treatment for post-traumatic stress disorder. So rather than once a week or once a month appointments, we see people every day. We see them for several sessions a day. They get exposure therapy in the morning. They get group treatment in the afternoon. We do this for 3 weeks straight. We have this treatment. We have given this to people from 35 different states, almost 2,000 people since the time we started this, and it works very effectively. So this was the challenge. How do we recreate these things? And what we found was that we could do it with VR. That's one of my grad students who was modeling for us. We can present these cues because if I can't set off an IED explosion, I could have you imagine it, right? I could tell you to imagine what happened. I don't know if you're imagining it. You could be thinking about puppies for all I know. So with VR, we can overcome that. We can present the cues, the sights, the sounds, and the smells. And the smells have been really, really important. Veterans coming back from Iraq and Afghanistan often talk about the smell of the country. They said it gets in your nose. You can't stop smelling it. When I was down with the FBI at Uvalde, the crime scene investigators would say the same thing about the blood. They say, I know there's no blood right here, but that smell is in my nose. I can't stop smelling it. So part of our virtual reality involves not just the presentation of sights and sounds, but the presentation of smells. And again, all of these are cues. The idea behind the therapy is that we teach your brain that just because you hear an iPhone ring, just because you smell something, doesn't mean that terrible thing is going to happen again. It allows people to get rid of nightmares. You know, people with PTSD say, I sleep 3 hours a night. That's all I can sleep. The anxiety is so high. Some people say, I won't sleep at all because I don't want the nightmares to come. Some people talk about flashbacks. They say, a Vietnam veteran told me once, he said, Doc, I was out in my garden. He said, I was working. I looked up. The other end of the garden was a Vietnamese man. He was working in a rice paddy. He says, Doc, he says, I know he wasn't there, but I swear to you, I saw him as clearly as I am looking at you right now. These are the symptoms of post-traumatic stress disorder, and this is what we attempt to get rid of with the program that we have. Smells are so important, as I said before. The interesting thing about smells is that it goes straight from your olfactory bulb to the fear center and the memory centers of your brain. It doesn't go anywhere else. It makes memories associated with smells very powerful memories and very emotional memories. So we need to include that. In the interest of time, I'm going to skip over the treatment because I want to get to what we did. Our treatment program, when we measure it against the 2 treatments that were being conducted at the VA at the same time we did our first study, what we found is that no matter what measure we looked at, the VA treatments are the blue and red bars. The green bar is our treatment at UCF. We were able to get 2 to 3 times the effective treatment outcome. I actually made the statistician run the results 3 times because I didn't believe it the first 2 times myself. But the idea of incorporating these cues through virtual reality and then providing this treatment in this very intensive fashion. And if you think about it, by the time someone is beginning to enter the 2nd week of treatment, they've had a really hefty dose and they're getting hope. And hope is a powerful thing. You know, it's the reason we keep doing the things that we do, even when they're difficult for us. And going through this treatment can be very difficult. But the idea is that people are getting better faster. We're moderating and using a medical model. We have in our program, not only do people get better, our dropout rate for this program is 2%, as opposed to the 28 to 40%. Our relapse rate at 6-month follow-up is 1%. So we've got something that is fairly effective. We've just replicated these results on 3 active duty military installations. We just replicated our program at Naval Hospital in Portsmouth, Naval Medical Center at Camp Lejeune, and also at Eisenhower Army Medical Center. And we've had the same results in this program. It's a little harder sometimes. You know, somebody would say, well, you're bringing all those people to sunny Orlando. Of course they're better. I'm like, you know, it's not always sunny, and about half the people live in Florida anyway. So it's not like they're down here for vacation. But that was the colonel at Fort Detrick. But so what we did, but there may be something about leaving where you are and coming for 3 weeks to work on yourself, particularly with 6 or 7 other people who have the same problem that you do. Right. So when people come, they come together, that we house them for no cost at the Homewood Suites. Thanks, first of all, to the federal government and now to the state of Florida government, who funds our program every year, where we can house people at the Homewood Suites. And they get free breakfast every morning. They get free dinner and 2 hours of free beer and wine 4 nights a week. No one's ever come drunk. I was told, oh, well, you know, if you're going to stress them and they're going to come drunk to sessions. Nobody's ever come drunk. I was told you can't do an intensive program. You'll get people so upset that they'll complete suicide. As I said, we're up to almost 2,000 people we've treated. No one has even attempted suicide, let alone complete suicide. What we're doing is showing people that this is not something that you have to live with the rest of your life. At the end of our 3-week program, 66% of veterans and 76% of first responders no longer meet the criteria for PTSD at the end of this 3 weeks of treatment. And the relapse rate is 1%. I'm going to accept your applause on the part of my clinicians who are the ones that really do all the hard work, and for everyone that we've seen in our program. The morning of the Pulse nightclub shooting, I got a phone call about 7:30 in the morning. I wasn't even sure what was going on then. And what I heard was that, you know what, we need you down here right now, fire department. We went down, and what we quickly found out was that there's no VA for first responders, right? What we also found out was that every year, more first responders complete suicide than die in the line of duty. Every single year. Most of it, not all, but most of it because of untreated PTSD. I know I'm almost out of time, so I'm going to go a little bit more quickly. We've replicated our program with first responders, and what we found is it's as effective for that group as it is for the veterans and active duty personnel. We've also, as I said, moved into mass shootings, mass casualties, the Champlain Towers building collapse. And what we found there was that the need for mental health after these types of events is for first responders writ large, okay? The medical examiner's office, the people who are there. We know of a crane operator who completed suicide after this event because no one thought we should be looking at the people who were getting rid of all of this debris. These mass casualties affect all of us. Our VR system, we now have a system that we can replicate any particular event and have the cues to make that you're all invited, not all at once because our offices aren't that big, but come over and see what it is. And I just want to let a sergeant from the City of Orlando Police Department have the last word.
So many bad scenes. I couldn't understand why this one scene.
I have no idea what I did there.
I've seen so many bad scenes. I couldn't understand why this one scene was bothering me. I knew that if I couldn't return to normal, I wouldn't be able to continue my career. I love what I do. So I was willing to do whatever it took. If they're asking for a little bit of help, that's exactly what I did. My name is Ross Hutto. I'm a sergeant with the Orlando Police Department. I currently work in the traffic homicide unit. One morning I responded to a suicide. The lady had written all over the walls, and it looked like something set up out of a horror movie. I started having issues that weren't normal. I guess they were panic attacks. Everything I was trying to do to make it better wasn't working. I just reached out to UCF Restores just to see what could be done. I didn't realize how advanced it was until I got there and how involved they are with all walks of life. We immediately got into exercises to try to help me deal with the panic attacks. And I noticed over time, the panic attacks started weaning off. And it was through some skills, or the skills, that I picked up, through using the program. And then once I started going, I started seeing a lot more firemen, a lot more police officers were there. And I just didn't realize how big of a program it was and how many people that were actually using it. So I felt more comfortable once I was there. I've told this story multiple times to people at work who I see are having problems, and I'll pull them to the side and talk with them. I'm like, hey, I ain't afraid to tell you, this is what I did and I got better, so go do it. And over time, you see them get better, you see them start smiling, coming around, return to their old selves. I want to retire as a policeman. I want to have a long career. I love what I do. I help people, I help underprivileged people, and I can't help them if I'm not there. And I have the tools that I learned through UCF Restores, and if it becomes a problem again, I'll go back.
Hello. You don't need to see me. That's just me. But I want to thank you for your time and attention, the opportunity to tell you a little bit about the program today.
Doctor,
Sure.
thank you so much for what you're doing. Thank you. We have time for about 3 questions. Here's number 1.
Okay.
That's absolutely amazing what you're doing. It's incredible. Thank you very much. It's a great program too. But how do you train your clinicians to have the effectiveness that they have?
Most of the clinicians who work with us, they're all licensed mental health clinicians, and we do put them through some training. They come to us, they learn the basics of this. We supervise them as they're going through their training. It takes about 2 to 3 months for them to feel comfortable because, again, most of them are not used to this. Clinically, intuitively, it doesn't make sense because people with PTSD are trying not to think about these things. And we're saying, no, you got to think about them. You got to think about them for like an hour at a time in our office. So, but they find that the treatment is effective. And when, you know, people like Sergeant Hodo will say, let me tell other people my story, then that's, you know, that's what we need. So thank you.
Again, thank you for what you do.
Sure.
I can certainly attest to how strong the smell associated to memory. How do y'all accurately recreate scents?
Yeah. Believe it or not, there is a company that will manufacture smells for you. And if you've ever been in a leather store and you think you're smelling the leather on those couches, no, you're not. You're smelling the leather that they're pumping, leather smell they're pumping through. Disney does the same thing. And so we've got smells. We've got some that are not so bad, like, you know, Moroccan spices for the cities that are in Iraq and Afghanistan. And we've got some that are like, unfortunately, bad smells like burning flesh. And what we do is people tell us what the smells are. We don't say, well, you're going to get this or you're going to get this. People say, this is what's in my nose. You know, this is the smell that triggers my panic, my anxiety. And so that's what we present. We've got little canisters, we've got a fan, and the computer will blow the smell out at the right time. So,
Doctor, thank you.
thank you.
It's so impressive what you're doing out there. We appreciate it so much. Thank you.
And to thank you. We appreciate it enough that we got you a special gift, a one of a kind, 1 in a million. Special gift for you. No, but we really appreciate the work that you do. Obviously, you're changing lives, and that's important.